Today I'm going to be talking about a very common condition called ovarian cyst, which has actually prevented a lot of women from getting pregnant. My name is Nurse Heidi, and I help you with your reproductive challenges. I answer questions regarding to fertility and anything regarding or concerning your reproductive health. Be you a man or a woman. No question is too stupid to ask. If you're in doubt, please hit my inbox. And what are you waiting for? Why haven't you subscribed to my YouTube channel? So it's Ask Nurse ID on YouTube and Ask Nurse ID on Facebook. It's also Ask_Nurse ID on TikTok. Whichever platform you find yourself, we are there. All right. So today I'm going to be educating us on ovarian cysts. Now, a lot of people confuse PCOS with ovarian cysts. Now, I'm here to let you know that ovarian cyst is different from PCOS. Let me just tell you what PCOS means. PCOS means polycystic ovarian syndrome. It is totally different from ovarian cyst, although these two conditions occur in the ovaries, but they are not the same thing. Okay? Let's dwell on ovarian cyst. That's the reason for this teaching. And sometime along the line, I can actually touch PCOS just to differentiate the both of them. Now, what is ovarian cyst to a layman? It is just a part of your ovary that has liquid, or you call it fluid, or you call it water for your understanding. A part of your ovary that has a small portion where there is water or there is fluid in it. So take for example, I have this cup here representing my ovary, okay, or representing the ovary of a woman. Have you seen or noticed that there is water inside this cup? And I haven't put that water to fill this cup to the brim. I just put a little, okay, at the bottom of the cup. This is what an ovarian cyst looks like. So the cup itself is the ovary of a woman, and we all know what the function of the ovary does or is. The function of the ovary in a woman is just to produce your eggs. And what are the function of the eggs? These eggs carry genetic materials. They are follicles that needs to be, fertilized. Now, take for example, this is the ovary in the ovary. So the cyst there means that there is a portion of your ovary that has water in it or that has fluid in it. I haven't filled this cup to the brim. That's because a cyst does not cover the entire ovary. It only finds a certain portion of the ovary and just stays there. So looking at this cup with water, this is a true definition of ovarian cyst. The cup is the ovary, the water is the cyst. A portion of your ovary that has fluid in it. All right? So to a layman, that is what an ovarian cyst is. But for PCOS, which is polycystic ovarian syndrome, I can't even start, demonstrating what happens. Now look at this, for example. All right? Have you seen that this has a lot of tiny portions or segments? Okay, it has a lot of segments, roundish everywhere. This is what polycystic ovarian syndrome looks like. So it has tiny portions or tiny sacs around the ovary. All around the ovaries are tiny portions. And what you can find on these portions, what is found on these portions is not water, it's not fluid. It is called follicles. These follicles are premature follicles. They just divide themselves and fill up the whole place. So none of them grows to maturity. And we all know that it's only a mature follicle that can actually be ruptured and be released for ovulation to take place. So in the case of PCOS, the ovary, take for example, this whole item I'm holding here is the ovary. And then it has a lot of designs, sacs, segments filled with follicles that are immature. And they never get to maturity, meaning that ovulation will not take place, because for ovulation to take place, one follicle has to actually grow larger in size and grow towards maturity, gets ruptured and releases, and be released for ovulation to take place. So get the difference. For ovarian cyst, this cup is the ovary. There's only a little portion that has fluid or water in it. For polycystic ovarian syndrome, this is the ovary, but the entire ovary is covered with tiny portions filled with follicles and never ever mature for ovulation to take place. Somebody with ovarian cyst may ovulate, but somebody with PCOS might not ovulate because of the immature follicles that, form round about the ovaries. Now let's talk about how ovarian cyst is formed. Remember, I said this cup represents the ovary. I'm going to use an egg to demonstrate how ovarian cyst is formed. Every month, this ovary, which is the cup, has the responsibility to do what? To release an egg for ovulation to take place every month. Okay? Now, this egg that the ovary normally releases doesn't just come in a raw form. No. It has a shell that covers it, just like this egg is. There is a yolk inside. Okay, this shell is protecting the main egg inside. So you need to be able to eat this egg, you need to break the shell, isn't it? So I'm using this as an illustration now. So the egg that gets fertilized by the sperm is inside this shell. This shell covering it now is known as a sac, or you call it a follicle. It protects the egg because the egg is very delicate. Okay, so after your menses, this shell known as the follicle will start developing. It will start growing slowly and slowly, okay, until it gets to a point where it reaches maturity at a certain time during the month. When it gets to that maturity, what will happen is that this shell will have to break open for the main egg to come out as ovulation, as that liquid, stretchy, transparent mucus that you see on your pants when you go to pee when you're ovulating. Okay, the shell that covers it will grow every month, and at a certain point it gets to maturity and it breaks open to release the main egg, which is known as ovulation, which will now station itself waiting for the sperm to come and fertilize it. But for some reason, most often you may find one follicle or one shell that will refuse to break open. Even when it has grown to maturity, it will keep to itself. It will keep to itself and say, no, 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 I'm not releasing the egg. I'm holding you. I don't want to release you this month. When it does not release that egg, for reasons I don't know, there might not be an ovulation that month, but you might not notice it as a person. Now, if the egg is not released and there is no ovulation that month, what happens to that egg that is inside the shell now? It will just remain there. Over time, it's going to form fluid. It's going to just liquefy. It's just going to melt. Let me use that word, and now form that liquid, that water that will just stay one side, in one part of your ovary and just be there as water. That is what is called a cyst. A cyst happens because there is a greedy follicle, there's a greedy shell that refuses to burst open to release the egg at a certain time in the month for ovulation to happen. Ovarian cyst happens because of that, and we call that functional cyst because it is part of a physiological process. It's just a natural occurrence that happens due to your ovulation process. It's not caused by an infection, it's not caused by a disease, it's just because a follicle was greedy. The shell was greedy. The shell that houses the egg was greedy. It didn't want to burst open to release the egg at a certain point, even though it had grown to maturity. So the egg is entrapped inside that shell and stays there. Over time, it now liquefies and forms a fluid and stays in the one part of your ovary. Now, the good news is that ovarian cyst is not so serious. It can happen and then disappear on its own. The fluid can disappear on its own without you noticing it. As a woman, during your childbearing years, as long as you menstruate and ovulate, at least once in a lifetime, 90% of women will have an ovarian cyst, which you might not even notice. Now, for some people who go for pelvic scan and it is detected on the scan that you've got ovarian cyst, because I've got some people who inbox me with scan result that says ovarian cyst. Now, I will not advise you to do anything immediately to that cyst. The only thing I would advise you to do is a follow-up. So 2 months later, go back again for the scan to check. Is the cyst still there? Or has it disappeared on its own? Because there's a tendency that if it happened just because that in that particular month the follicle refused to break open for the egg to be released, it might be that it will disappear on its own. So 2 months later, you're going back again to do a scan, a pelvic scan. If it has disappeared on its own, that's good news. If it hasn't disappeared, what we are going to be looking out for is, okay, where it was stationed, is it still stationed there? The size it was, the portion of the ovary that the fluid was, has it extended or is it still there, just stationed? It hasn't enlarged, it's just there, it's not causing any harm. Those are the things we should be looking out for. So most often they're not going to be in a hurry to place you on any medication, or it's just more of a follow-up to observe you, do series of scans, at certain time intervals to know if this cyst is growing larger, is it smaller, is it causing serious concern. Sometimes it disappears on its own. But in a situation whereby the cyst now starts growing too large and now causes, maybe decides to burst open, to empty its content into the ovary and the pelvic organs, then that is an emergency situation. Okay, but that's a very rare condition. It doesn't really get to that. Okay, let's talk about the management. So if I discover that I've got ovarian cyst, what do? That I will advise you not to do anything. Just go back after 2 or 3 months, do another scan to find out if the cyst is still there. Ask the doctor, is it larger than the first time I did the scan? Has it extended? Is there any risk of it bursting open? Those are the questions you should be asking. And then if it poses a serious threat, that is the point where you might likely think of, a surgery, like a procedure that will be done to actually tap the fluid out of the ovary and, just become free. A procedure can be done to tap that fluid out of the ovary to
so that you just be okay, and there's no risk of it growing larger and larger. You can also take pain relief, because for some people you start experiencing pain as one of the symptoms of ovarian cyst. Bloating in your tummy is another symptom of ovarian cyst. It is different from PCOS.